Hey everyone, welcome back to the YMyHealth podcast. It's your co-host Melissa Schenkman here, and today we are going to be talking about a very important topic for the fall. And we all love the fall season with everything from the change in weather and our pumpkin spice. But one of the things that's really important that a lot of us have on our to-do list to think about is vaccines for those fall viruses that are going to be coming our way, especially as we get into the holiday season. And so we are very fortunate to have two friends of YMyHealth here with us. We have Dr. Lindsay Morrison joining us on the podcast for the first time today. So welcome, Lindsay.
Thank you so much for having me.
You're so welcome. Dr. Morrison is a board certified infectious disease doctor who has joined us on the YMyHealth website in the past to cover flu season and monkeypox as well. And we're also very fortunate to be joined by Dr. Alexandria Yarbrough. Uh, hey, Alex, thank you so much for joining us.
Happy to be here.
Awesome. Dr. Yarbrough is a pharmacist in charge in South Carolina, and she has been on the podcast a few times since we started on different topics, as well as contributed her wonderful writing to the Why My Health website. So excited to have you both to talk about what is, I would say, such an unusual fall season when it comes to viruses. We said this a couple years ago, right, when COVID came about, but I think this year, just because of a lot of talk and the different climates and things, there's just a lot to talk about and a lot to think about. And so I'm really excited to have you both with us. So just to kind of kick things off, I just want to say to everyone as we start, we realize that a lot of health stuff in relation to vaccines has been made political, but it is not political. Health is all about the science and the facts. And that's what we're here to talk about on the podcast because it can be really confusing with hearing all these different messages and really each of us want to make the best decisions for our health. So um, just kind of to start, and on that note, what are some of the things that bother each of you as a millennial and as a healthcare professional about the current climate and the conversations that you've been hearing over the past, I'd say, 6 months off and on? A lot of us have been hearing when it comes to vaccines as we go into this season. And who would like to start on that note?
I can start that off. I think from my perspective, so I'm coming from a clinical perspective. I'm a patient facing in my position, not really on the laboratory or research side of things.
Sure.
And I think that there's been a lot of distrust and lack of faith that's been sown because of how messaging has changed so much. And that really is, I think, upsetting as a healthcare provider because what we want to do is provide the best care, fact-based, evidence-based care, and that becomes difficult when the messaging is changing so frequently, and when there's so much dissent in what should we be doing. That's coming not just from the community, but from now our government officials. That there's been some differences of opinion. It makes it very difficult, I think, for people to know where to turn, who to believe, what to do with their health. And that's really challenging because trust is such an integral part of a healthcare relationship.
Yeah, absolutely. Absolutely. What about for you, Alex?
Well, I think since the information isn't out there, I think people forget how severe some of these issues can be.
Yeah.
And that's really hard as a millennial because you do think you are in that age group where you won't get as sick or you are overall pretty healthy. And since we don't have that access to the information, it is a lot of there's a lot of concern with what exactly we should be doing and what we need to do in order to stay healthy.
Absolutely, absolutely, and I think there's so many who join both of you in feeling this way, and in the millennial community and beyond, people just don't really know where to turn to, and I'm hoping our conversation today will really shed more light on things for sure, and part of that confusion, there are all these kind of conspiracy theories, if you will, for lack of a better term, although that's a term that I know a lot of us have heard in the past 6 months, but it's really misconceptions, in a sense about vaccines. And so I'm really curious, both of you in your experience, kind of what are some of the ones that you've heard circulating, and if you could kind of pick those apart as to why those just simply aren't true.
I think one of the specifically for kind of the seasonal vaccines, the one that I hear the most from my patients is that the vaccines make them sick. Um, and I think that this can be very confusing because there is an effect to a lot of vaccines where you might feel unwell. I think a lot of that is feeding this idea that they're getting sick from the vaccine and that if they don't take the vaccine, they're not going to get sick. So the vaccines, especially the flu, COVID, these seasonal vaccines do have the potential because they're so immunogenic because they're driving your immune system's response to make you feel like you're sick. Because when you're feeling sick, that's exactly what's happening. Your immune system is driving your fever. It's driving these achy bones because you're increasing your white blood cell supply, which are all made in the bones, and you feel crummy. Um, but that's because your immune system is active. Um, it doesn't mean that you have an infection, but it does have the effect of making you feel unwell. So
Mhm.
it's really, I think, a point of clarification that I always try to make. Now, that may people may decide that feeling unwell for 2 days is not worth the benefit they get from the vaccine, which is a whole other topic that we'll touch on. Um,
Yeah.
but there is ample evidence to show that you don't get sick from these inactivated vaccines. There are some vaccines that do contain live virus that have a very, very small potential to cause vaccine, but those are generally not the vaccines that the majority of the population is getting. Um, I will also say that there is the potential to get sick at the same time you get a vaccine, which may have nothing to do with the vaccine. But again, I think this is kind of going back into that bigger picture of what you feel doesn't necessarily, it's what you feel is real. If you feel unwell, if you feel sick, that's a real thing. You're feeling those things, those are happening to you. But the
Yeah.
cause may not be exactly what you think it is. So that's something that I try to clear up.
No, that's an excellent point. And Alex, what about for you? What are some of the misconceptions or these conspiracies about, conspiracy theories about vaccines that you're hearing?
I hear a lot of that the vaccine is unsafe because of some of the ingredients in it. And unfortunately, that's just kind of misinformation because people just don't really fully understand how they're made or how they're developed. So a lot of times people are concerned about different like aluminum or mercury inactive ingredients being in vaccines where they don't really realize that we don't often use those. Thimerosal is the mercury that everyone is afraid of, and it's used in multi-dose vials. But in my over 10 years of giving flu shots, I've never used a multi-dose vial. They're all single doses, so they don't even have the thimerosal.
Mhm.
So I think the biggest thing for me is if you have those concerns, and which are very valid. I definitely don't want to be injecting heavy metals into my body, and I don't think anyone does. Just talk with your pharmacist or talk with your doctor or anyone in the healthcare field that has that knowledge about what's actually in them, so that way we can ease your mind that there are no ingredients that are there to be harmful. Vaccines are extremely safe. There are so many steps to development before they even get to you, and we get them ourselves. So we wouldn't give something to you that we don't feel is safe. We give it to ourselves as well.
Oh, excellent points. An excellent point about the thimerosal. I know that's always been uh such a kind of a hot topic, or become a hotter topic in the last couple of years, and I think people would be very surprised to find, I know even for myself, because 'cause I've talked to, multiple pharmacies at different times, and they're all like, "Oh, yeah, they're all thimerosal free." Like, yeah, so I think people would be very surprised to find out, like, this is not the issue that they think it is on this process, so appreciate you saying that. And for you, Doctor Morrison, I was gonna say Lindsay, if I call you Lindsay.
Sure, that's
Okay. Um, Part of the climate of all this, we have a, um, not new now, but still new, director who's the head of the Health and Human Services, RFK Jr. Everyone knows about this. How is that when you kinda think of on a system-wide? perspective, how is the person who's in that seat as a director, how does that affect CDC recommendations when it comes to vaccines in particular? Or how could it?
Right. So I think that's an important distinction is as of now, a lot of the ACIP guidelines have not been changed because the meeting is not happening for another 4 days. I think it's next week that
Oh, wow.
this is
Remind us.
happening. So
Maybe
the
on
ACIP on
immunization
immunization
practices, yeah.
practices, yep. So the ACIP, the
Advice.
Advisory Committee on Immunization Practices.
Perfect.
So that's the body that's basically creating the vaccine recommendations for our country. And it's really what providers follow, what insurance companies are going to follow for coverage. So they're going to be meeting next week to kind of give updates on what their recommendations are for immunizations moving forward. Um, so we don't know what's going to happen exactly, but there's been a lot of rhetoric about how these may change based on the current administration and leadership in the HHS. Um, and one thing that has happened already is, for example, the flu meeting that we generally have prior to the development of the flu vaccine did not formally take place this year. Fortunately, the data that we used was still available, so functionally that may not have changed very much about our flu vaccine this year, but there is concern that changing the way we've kind of collected information and shared information within these bodies may change. And I think there have been some concerning statements by RFK Jr. and some of his appointees about vaccine efficacy and safety.
Mm.
So, for example, there is now going to be another study on the link between vaccines and autism, because
Mm.
that is a belief of our HHS director that there is a strong link. This has already been thoroughly debunked, and the studies that have been linking those together were retracted and debunked. So we already have robust data to show that there really is no link that we can identify. Um, so there's a concern that there may be some revision on the way that we review our scientific data and the way that that data is disseminated. So it's leading to a lot of dissent and confusion. I know that a few medical governing bodies have taken very strong stances in opposition to some of the stances being put out by the current healthcare administration because of this difference of opinion on how the data is being interpreted.
Right. Knowing that, and for everyone knowing all the things that we've just highlighted, that Lindsay and Alex have highlighted, why should our fellow millennials, at this point in their lives, those in their 20s, their 30s, or early 40s, um, you know, be kind of concerned about this and ask questions of their providers as they make their decision as well.
So again, I think it kind of goes back to evidence-based recommendations um, and how that's going to affect vaccine uptake. So
Mhm.
people in our age group are, at least by age, not meeting definitions of high risk.
Mm.
But there are, of course, those of us in our 30s and 40s and late 20s that do meet those criteria of being high risk. Um, so for those that are at higher risk in the population, availability of vaccines, but also uptake of vaccines are going to impact how your risk impact your risk of getting disease. I think that's one thing that is a little bit harder for people to wrap their heads around is that when we're talking about vaccinations, we are talking about personal health, but we're also talking about population-based health,
Mm.
which is a little bit different than a lot of other healthcare decisions people will make. Is that your decision whether or not to get vaccinated does actually have a big impact on your community. It's not just having an impact on you. I think that can be harder to understand and harder for people to agree to make decisions that are better for the community. But I always like to point out we're also a part of that community. So let's say, you know, I don't want to get my polio vaccine, but nobody else wants to get it either. The
Yeah.
choices of my community not to get that vaccine affect my risk for that vaccine. So the more people that have vaccine uptake, the more protected we are as a community, as a total population. Um, and you know, I think there's a false sense of security by the fact that a lot of our vaccine preventable illnesses have had very low circulating rates for most of our lives. You know, we grew up in a time period where people got a large number of childhood vaccinations that weren't available for our parents' generation. So we grew up not seeing polio. Maybe you knew somebody who had some sequelae of that, or you know, some neurologic deficits from when they had polio, and they're much older than you, but you don't see active polio really. That doesn't mean polio is gone. It just means we've managed to tamp it down. But is still circulating polio in the world. It's been identified in sewage systems in different parts of the world. There is potential for these things to come back, and we are seeing that with the measles vaccine. So
Yeah.
that's something that I think is really important. You know, lower measles uptake for the vaccine has led to larger amounts of measles in the circulating community. Um, Not all of our vaccines are 100% effective. So even if you're vaccinated, you could still have the potential to get an illness, even though your risk is lower. And also the likelihood of you getting a severe infection is lower. But the other thing that I think is important is that I think people in the millennial age group also are parents a lot of the time, you know, parents of young children. So these recommendations are changing a lot more for pediatric populations too. And again, this is kind of speaking less towards these seasonal vaccines, although that's included too, but these longer lasting kind of lifelong vaccinations that we've all kind of been accustomed to.
Yeah. No, absolutely. And far as, the two main vaccines that are on all of our minds, are of course the flu and the COVID-19 vaccine as we get into the fall. And I want to kind of start with talking about the flu shot and also um to Lindsay's point about the pediatric population. I know a few years ago, Alex, you wrote a book specifically, yeah, specifically for kids, in regards to getting the flu shot. So I was just thinking about that as Lindsay was talking about the importance for millennial parents and the pediatric population too. Kind of as we look kind of to this fall, I know that in Australia, that part of the world is kind of wrapping up its winter season. What is the scientific data so far from Australia's, flu season looking like right now?
So the data from Australia, the the interesting thing is that, you know, with these hemispheric differences, we do see the circulation of the flu at different times of the year. So in North America, ours is going to be October through early spring, March, April, versus in Australia, we're going to be more April through October. So for the 2025-2026 flu season in Australia, um, we saw a very severe flu season. It was, I think, the second worst in the decade. And it peaked very early. So the numbers really got high fast in the early part of the flu season. So between April and May, we really hit the peak, and then it started tapering off in June. Um, so this meant that there was a large number of circulating flu cases in a very short time frame. So there was really rapid spread in the community and unfortunately a lot of hospitalizations. Um, there was also a lot of co-infection because there was also a lot of circulating COVID and RSV at the same time. So that kind of hit everybody extra hard, but there were very high flu numbers. Interestingly, this was also correlated with low vaccine uptake, which has been kind of consistently waning over the last several years, especially in the patient population over the age of 65, which are higher risk population for severe flu infection. Um, so that was the largest number of hospitalized cases were people over the age of 65, although there were a large number of pediatric patients as well. So again, those are going to be the two highest risk groups: of the very young, the very old, and the immune compromised. So that's something we wouldn't, it's not surprising, but it does mean that there were larger numbers of hospitalizations than typical, less vaccine uptake in those vulnerable populations than typical, and it was a very high rate of climb early in the season. So it's always a little bit tricky with the flu data because we're trying to make predictions of what's going to happen in the northern hemisphere based on what's happened in the southern hemisphere. It doesn't
Mm,
always happen exactly the same way, but it
mm.
can help suggest what we may see. So the we do help, part of our strain selection is based off of the flu data from the preceding year,
Right.
but also the the severity of the infection. So we may see a pretty severe flu season this year in the 2025-2026 year. Um, and again, our flu season is going to be coming up now. And we generally recommend vaccinations sometime in the September-October realm. Um,
Now that you're kind of giving us the lay of the land, and I know some people may not, for those who don't realize this, like a lot of times the predictions for the US's flu season come off of what's being seen in Australia. So that's not good, what's being seen in Australia. So we know that from listening to what you were just saying. But in terms of our flu shot that's going to be given here in the US, um, let's kind of talk about that first, far as before we get into timing. So Alex, what the flu is the vaccine targeting, and anything out there talking about effectiveness level?
So as of right now, the we don't know the effectiveness level, and we don't really even know it from the last season. So when
When
I went to the CDC, it looks like the final estimates for the 2024-2025 season won't be available until November, unfortunately. Some of the preliminary data said that there were up to 82 million illnesses in the United States in 2024, but there's really no way to know at this point. They also estimated up to 130,000 deaths. So I'm really curious to see when that data is available, hopefully in November, because right now it's just preliminary. But I can speak to what the vaccine is made of and what it targets. So there's 3 different strains, and that's across the board. So if you're getting just a regular flu shot and you're under 65, you're going to get all 3 of the strains in that vaccine. So it's going to be 2 strands of A and then 1 of B. So the A is going to be H1N1, and then it's also going to be H3N2. And then also the B strand, which is a Victoria virus, not as important, not as well known as the H1N1s or the H3N2s. But that's also going to be in the high dose vaccine. So if you are over 65, those 3 components are going to be in there as well. And then if you are getting the flu mist, which is the nasal live vaccine, same thing. It's also trivalent, which means 3 strands.
Oh, I appreciate that. That's very interesting and good to know that it's gonna cover all of those. And Lindsay, speaking of Alex, speaking of the flu mist, uh, that is actually the next thing I was gonna ask about, because flu mist to a lot of people is new. It was not approved until literally like almost a year ago. September 20th, 2024 is the date that it was approved. So it's only been active during one flu season here in the US. And so has there been any data out there, anything talking about how it held up in terms of effectiveness compared to the injectable vaccine?
Yeah, and so just to kind of give a little bit of background, the flu mist is an intranasal vaccine, and it's a live virus, live attenuated vaccine. So it's a little bit different in its makeup than the injectable vaccines that you would be getting, which have zero potential to cause infection because they're not made of live virus. The intranasal is an attenuated virus, so it's weakened. So its risk of causing infection is very low, but it's not zero. So
Okay.
this type of vaccine is not an option for people that are highly immune compromised, meaning on chemotherapy, with HIV, for example, or in certain age groups like the very young, under 2 years old, and over 65.
Mm.
But for the millennial population, it is an option. Um, and it's held up reasonably well. It's got, I think the injectable vaccines had a little bit of an edge as far as efficacy, um, but it did well as far as its coverage. They were very similar numbers. Um, the one thing that I would note was that in pediatric populations, there was a slightly higher risk or higher rate of seasonal wheezing. So if you're thinking about the intranasal vaccine for your children, it might be a good idea to talk to your pediatrician first.
Mm.
But one of the great things about this vaccine also is that it's available at home. So it could be, you can give it, it can be self-administered, and it's available to ship to home. Um, so I think access is a big piece of, again, like when we're talking about coverage and making sure the community is covered. Um, the medication that you can get is better than the one you can't, because you can't take a medicine you can't have access to. So for those that have difficulty getting access or getting to the pharmacy, this might be a good option. Um, and again, the data's a little thin because we haven't used it so often, and it hasn't been used in the same numbers, but seem to be effective for those that are eligible.
That's really good to hear, and I think, far as for millennials, I know you were mentioning, in terms of if you have children, talking with your pediatrician about that for flu mist. In terms of millennials, adult millennials themselves, in their 20s, 30s, and early 40s who are trying to decide between getting the injectable or trying out the flu mist, any advice in terms of that and who to talk to as well?
Yeah, so I think, I always encourage everyone to talk to their own physician, but there's a little bit of an edge to the injectable vaccines as far as performance. The live virus vaccines tend not to perform quite as well. And there are a couple of different types of the injectable flu vaccine that also
Mm,
have a little bit of variation between them. So, for example, the recombinant vaccine, I think, tends to perform the best, but they're slight differences.
mm.
So, I tend to recommend the injectable vaccinations because they have a little bit better efficacy. Um, but I do think that the Flumis is a great option if you're too busy to go somewhere and you just want to give it at home, and if you're healthy. So that's really the kicker. I think a lot of people will have potential disqualifying conditions, but if you don't, I do think that's a great option.
Awesome. Very helpful to hear. And are either of you hearing, far as the flu vaccine, anything about changes in terms of accessibility so far for people under age 50 in particular, in terms of like even where you can get them? Traditionally pharmacies, standalone pharmacies, grocery store pharmacies have them. If you're going to happen to be where it coincides with your annual physical exam, a lot of times your doctor happens to have them as well. So anything on that, and I know Alex with pharmacies, anything you've heard.
I have not heard anything, which is great. So I don't know if things are going to change. Hopefully not. Hopefully they will keep hands off of flu access. But as of right now, there are no changes, and you can still get them at your preferred pharmacy or doctor's office like normal.
Awesome. Awesome. And I want to switch gears now and talk about the other big vaccine in the picture now for us every single fall for the last couple years, which is the COVID-19 vaccine. And, when it comes to that, uh, Alex, on your end, what are some changes, that you've been hearing so far about this fall's vaccine?
So, as for efficacy and the type of vaccine and what you're getting, there really haven't been any changes other than it is the updated 2025-2026 formula. So, you will get the most up to date vaccine if you are able to get it. The issue happens to be with access, and it depends on what state you live in. And if your pharmacy board has issued like a standing order, if you're under 65 and you have an underlying health condition, that you're absolutely qualified to get it. And I think I mentioned it earlier of having to turn patients away, and it's not something that I want to do. I want to vaccinate everyone who wants to get a vaccine. But at this time, there are a lot of different steps you have to take to get it.
Oh, wow. It's just so unfortunate, and like you said, I really hope that changes and those that barrier is removed. In terms of being, as you were saying, you can the vaccines are there, but if you're able. So the question is,
Mhm.
in terms of eligibility, I know there are multiple groups that um, have been put. I think there's a list. There are a couple different lists out there who've been, given eligibility to get the COVID vaccine and to get it covered, because that's the whole thing. Too, part of that eligibility list is not only to have that access, but to have your insurance company being mandated to cover that. So one of the big key things we were talking about before is you can get a COVID-19 vaccine if you're able to. The question is that ability not centering, and it does, not centering necessarily around insurance coverage or cost, but before you could even get to that point is whether or not you're in one of the groups that's considered eligible to be able to do that, and we're all obviously well under the age of 65 in our YMyHealth community. So given that, kind of what are some of the groups that you have heard are considered eligible to even approach this and walk in the door?
So in the past, it was everyone, but now they have two very important distinctions. So anyone over 65, so our parents, grandparents, and older family members, they are 100% qualified just based on age alone. The other people that qualify are going to be those who have underlying health conditions. So if you are pregnant, if you have cystic fibrosis, diabetes, type 1 or 2, if you're a smoker, former smoker, anyone who has asthma. So there is a long, exhaustive list of a lot of people that do qualify. So if you have any type of chronic health condition, or if you are in a certain state, like you are pregnant or just recently pregnant, you still qualify. So definitely go to the CDC if you can, see if you do qualify, because I would like everyone who is able to get the vaccine to get it. And you might not know if you qualify. So 65 and up, and then underlying health conditions are the only people at this time that are approved.
Oh, well, thank you so much for highlighting that information, because that's so important, especially because for us, to your point, we aren't, we aren't in that group unless we have one of these conditions at this time. As a millennial, so that's really important for everyone to look into and find out. And hold on, let me switch my page here. um, Let me ask you this though: when it comes to the flu vaccine and the COVID-19 vaccine at the same time. Let's say you are eligible for both. I think this is a question that people ask themselves every year. Um, what are your opinions, when it comes to getting both those shots at the same time? And who should attempt to do that? And who should definitely not do that?
So, getting both shots at the same time has been shown to be safe, with data that we have from people that have received concurrent administration.
Right.
There is actually a little bit of data that suggests there may actually be an enhanced benefit to the COVID vaccine when co-administered with the flu vaccine, although that data is only for patients who got the mRNA-based vaccine, the bivalent mRNA-based vaccine. So the Novavax, which is the non-mRNA vaccine, was not. They didn't have not published data about that anyhow. So I don't
Inter-
know if it would have a similar efficacy, but it's safe to do. It's certainly convenient. I'll let you know that I personally have been getting mine together and just got my two vaccines Friday, by someone with a qualifying condition for COVID. Um, and um, the major restrictions that we generally place around getting vaccines just has to do with whether you're ill at the time of vaccination, um, which really has more to do with the fact that, again, these are very immunogenic vaccines, so they're going to boost your immune response, which can become dangerous if you already are fighting an infection. And again, that enhanced immunogenic response with a dual vaccination could be potentially detrimental, but that would really be the only restriction that I would place around that.
Great. I appreciate you explaining that because I think people are always wondering about that, and also for you, Alex, having given so many of these through the years, and when people come in to your pharmacy to do them, any particular things? I'm thinking about like the paperwork too that we always fill out. Anything in particular that when you're looking and people are saying, "Well, I'd like both," that come up.
Well, it's incredibly convenient, as Lindsay said. So I definitely encourage people, if they tolerate vaccines really well, to get both at the same time. I can do two in one arm. I can do one in each arm. It's completely up to them, as long as they're non-live vaccines, which the flu and the COVID vaccines are. So I definitely encourage people to get them at the same time if they can.
Oh, awesome. Appreciate
And
that. Oh yeah.
just since I touched on it a couple of times, this kind of like, post-vaccine syndrome that people can get where they feel kind of sick for a day, maybe two. Um, there is actually a little bit of data to suggest because not everybody feels that way. Some people get these vaccines, they feel 100% totally fine, no
Yep.
symptoms. It is equally effective for people that do not have those post-vaccine symptoms as it is for those who do. So if you don't feel like you feel kind of crummy after a vaccine, it doesn't mean your immune system isn't doing its job. I just want to point that out, that it's still effective whether you feel it or not.
I really appreciate you saying that because I do. It's a real mix based on the individual's body. I do know several people who are much older than all three of us who have had no problem after getting both of them. Some who've gone both in one arm, brave souls, as I say, and then they're fine. And then there are those of us who are like 20, 30 years younger than them, and we do not feel good for a day. So in both cases, we're all protected. So just totally different experience. So I appreciate you highlighting that. And is there an optimal time this fall for getting your flu shot, for getting your COVID-19 vaccine if you qualify uh, to do that? Because I think for every millennial, the biggest challenge, as we all know, is time. It's so limited. And
Yeah.
so we really want to put this on our to-do list, but sometimes I think people wonder, if I get it this month, will I be less protected as opposed to if I get it that month? So if you could answer that for us, I'd be very curious.
So there's a little bit of a range as far as the optimal timing. What we tend to recommend is sometime between September and November, um, just because that's when the flu season starts to ramp up. COVID circulation, we don't have as clear of an understanding on the seasonality, so the timing of that is a little bit different. But the durability of COVID protection is pretty good from the vaccine. So that one, I would say again, if you're going to get your flu shot and your COVID vaccine, go ahead and get them at the same time. There is a little bit of, interestingly, with the flu vaccine, a little bit of data that suggests that immunity does wane a little bit sooner with the flu vaccine. So, if you're not necessarily at high risk for a severe flu infection, so if you don't have underlying respiratory illnesses or an immune compromising condition, it may be beneficial to wait a little bit towards the later end of that range, just so that it carries you through the tail end of the flu season through January, February. But that is based on pretty like slim data, I would say. So there's not been any clear recommended updates on recommendation, like official recommendation for doing that. That's just something that we have seen, that immunity can wane a little bit. So to get your kind of biggest bang for the buck, if you wait a little bit later, you're getting the majority of the flu season covered if you wait a little bit on the tail end. Now, again, based on what happened in Australia this last season, that may not be the best idea, but it's hard to say whether or not we're going to have that early spike in flu. So I would say anytime in the September, November timeframe, when you can get it is when you should get it.
Mm, excellent advice. And as we wrap up this episode, as a pharmacist, as an infectious disease specialist, respectively, Alex and Lindsay, what are would like people under the age of 50 to kind of keep top of mind when they are making this decision? about getting their vaccines this fall. And whoever would like to go
Yeah.
first.
I think the biggest point I want to drive home is that these vaccines are safe and effective. They have been tested extensively. They are there for us as a resource to stay well. It's preventative health, and it's something that I hope we continue to have access to. And to think that it's not only for ourselves. Yes, we don't want to get sick. We don't want the flu. We don't want COVID, but it's also for our entire community. It's a part of public health. It's for the winter season when we're going for Thanksgiving or any of the winter holidays. It's for everyone. It's for the really young. It's for the really old. So just remember, it's safe and effective, and it's for everyone. And it's for the greater good.
And
Absolutely.
one thing I also want to point out is, I think from a personal health perspective, um, with respect to, people that don't like getting shots, they aren't sure that it's going to have enough efficacy for them. They don't want to feel unwell for a day or two. I always like to remind people, again, with respect to the efficacy of these vaccines, what we're talking about is a pretty minor inconvenience for a pretty major benefit. So, getting sick with the flu, getting sick with COVID, you're potentially down for a week, 10 days. Depending on the strain you get and your underlying conditions, you could be looking at a much more severe illness and potential hospitalizations, post-viral respiratory issues, which can linger for weeks to months. So there are a lot of downsides to getting these infections, and these vaccines do a great job in preventing infection. But even if you get an infection, preventing severity of infection. So you're much more likely to bounce back quicker and stay healthier. So when we're looking at kind of the balance of the downside of the vaccine versus the upside, I think it's clear that they're worth getting.
Absolutely, absolutely. Well, thank you both so much for taking the time out of your busy schedules to share your wealth of experience with us all these years and your your knowledge expertise because it is a confusing time for everyone as we said in the beginning and your perspective on both these vaccines as we approach this season is just so helpful to us, so really appreciate it. Thank you so much, Dr. Lindsay Morrison and Dr. Alexandria Yarbrough.
All right. Thanks so much, Melissa.
Thank you.
Thank you. Let me